Hi, I'm Melissa Evans, vet tech specialist in emergency and critical care. You're watching Vet Candy.
This show is brought to you by CareCredit, helping veterinary practices discover more ways to make care possible. Learn more at carecredit.com/vetinsights.
Blood transfusions are a common procedure in medicine. Donated blood is used to replace blood lost to injury or surgery, or to treat serious medical conditions. The procedure is not performed as routinely in the treatment of cats as it is with humans, but it can be life-saving. The availability of cat donors has been a limitation in primary care veterinary practice. But with the growth of blood banks providing greater access to feline blood, the procedure is likely to become more commonplace. To address the need for authoritative guidance, the International Society of Feline Medicine has published consensus guidelines in the Journal of Feline Medicine and Surgery. The authors are veterinary experts with individual expertise in infectious disease, anesthesia, critical care, and internal medicine, with cumulative clinical experience in the collection of blood and administration of transfusion for thousands of feline patients. Managing a patient that requires a blood product is clinically challenging. Identifying the need is just the first step. The clinician needs to establish a clear-cut benefit to the recipient, and critically, must ensure that compatible blood is administered. This requires blood typing of both the donor and recipient cat. Whether an individual is type A, B, or AB in the blood group system that exists in cats is partly influenced by geography as well as by breed. Type A is the most common phenotype worldwide, and Siamese cats, for example, are believed to be exclusively type A. Type B is much lower in prevalence, though is reported to be common among non-pedigree cats in Australia and also among British shorthair cats. Type AB is rare. Blood types arise due to genetically determined antigenic markers called alloantigens that are present on the surface of red blood cells. Unlike dogs, cats possess naturally occurring alloantibodies against foreign alloantigens. This complicates the process of blood transfusion and can lead to potentially fatal blood transfusion reactions. While the risk of a transfusion reaction increases with subsequent transfusions, a reaction may arise even with a first blood transfusion. It is strongly recommended that cross-matching is done for any recipient with an unknown transfusion history or that has had a previous transfusion. To assist in this, International Cat Care, the parent charity of ISFM, has created a resource that is available on their website, explaining what to expect if owners are considering volunteering their cat as a blood donor, or if their cat requires a blood transfusion. The aim of these new guidelines is both to facilitate this process and help ensure that the health and well-being of recipient and donor cats is equally prioritized. Up next, something fun.
Hi everyone, I'm Dr. Jen.
And I'm Dr. Jess, and we are co-founders of Vetique Chicago.
Vetique's vibe is all about making pets and their people feel good about their experience. And the important part of that is making it easy to pay for veterinary care.
That's why we provide our clients with payment options, including flexible financing. CareCredit is an option that we are big fans of. It's a credit card that can be used for their pet's care and their own.
Today, we are going to tell you some things you may not know about financing and how beneficial it can be for the pet parents and your team. Let's start with this question. Which clients can benefit from knowing about payment options available to them?
100% of them. You never know someone's circumstances. Many people get stressed when the bill is $250. Think about how many invoices are $250 or more. In our practice, it happens every day.
Right. Sharing payment options with each client while discussing treatment options keeps it simple. And if a client decides they'd like to look at financing, it's super easy for them to learn about it right from their phone. When your clinic accepts CareCredit, you get a QR code and digital link that's personalized for your practice. Here's another eye-opener. A lot of vet teams think CareCredit is just for unexpected emergencies and unexpected treatment. While it's definitely great to have in those situations, clients can and do use it for everything from annual exams and vaccinations to food, parasite control, and prescriptions.
That's why we don't wait until that stressful moment when the cost is high to share financing options.
Some clients love having a safety net with both CareCredit and pet insurance.
Right. Having both gives them an extra layer of financial peace of mind. Together, they provide a more complete financial solution to pay for care. Until next time,
bye.
I hope you enjoyed our show. Stay up to date with everything VetMed by subscribing to our channel. You can also follow us on social media at MyVetCandy. Thanks so much for watching.